everyone, and welcome back to the Arthritis Broadcast Network's hashtag CR Arthritis. And I'm Isabelle Troitsky. I'm with ACE and program manager of the Global RA Network. I'm happy to be joined by Dr. Suzanne Morin today, and it's our second interview of the day, and we'll have interviews over the next 3 days. Very thrilled to meet all these great people, healthcare professionals, and other people from the arthritis community. So Dr. Suzanne Morin is a clinician scientist, general internist, and epidemiologist with expertise in osteoporosis. Dr. Morin is also associate professor of medicine at McGill University in Montreal. So thank you so much for being here today.
Thank you for having me.
Great. So I'll start with a very simple question. Who are you? What is your role and what's your involvement in rheumatology?
Thank you. So I'm, as you've mentioned, a clinician scientist. So I do, part of my time I spend looking after patients who have complicated medical disorders, including disorders that involve arthritis and inflammation. And my specific clinical interest has to do with bone health of these people. So I ensure that their bones are as strong as they can be, and if not, then we try to improve them through various interventions. My research interest has to do with osteoporosis as well, and how we can create better interventions to prevent fractures, because fractures are really the main consequence of poor bone health. This can happen, of course, with people without arthritis or any kind of inflammatory diseases, but is more common in people who have inflammatory arthritis.
Yeah, so great. Yeah, very important area. So can you tell us, and what patients should retain from that presentation that you gave?
So I gave a presentation to the trainees, so to the residents. So this is actually a very nice opportunity to train the future, rheumatologists, and so to ensure that they have actually this important background knowledge. So bone health is something that's really important because it is also integrated within the entire musculoskeletal system. So if your bones are healthy, it's often because your muscles are strong and because your joints are well looked after. So if you have a good not too much pain, not too much dysfunction in the joints, and good strong muscles, the likelihood is that you're going to have very strong bones. Now, of course, there are interventions when people have arthritis that can make the bones become a bit weaker. So the idea is to be aware of this and to have the interventions that will, or to implement the interventions that will try to either counteract the effect of the medication or to just kind of improve bone health in general. So there's various things we can do for that.
Okay, and so working with different healthcare...
Correct. So we work with different healthcare professionals. So we work often with nutritionists because nutrition is extremely important. So having a good intake of vitamin D, having a good intake of calcium through the diet, and working with exercise professionals, particularly either kinesiologists or even trainers, to improve your muscle strength. Strong muscles equate strong bones. It's very important. And then sometimes people require medication, so often the rheumatologist or another specific physician can work with the patient to discuss what are the different options in terms of medication. So, and my emphasis was that the importance of exercise and the importance of nutrition need to be emphasized.
Yeah, we know sometimes to exercise, but not for the good reasons. But bone health is one of them, definitely.
Now, yeah.
Okay, and so the theme of this year's scientific meeting is reconnect, renew, and reimagine. So we spent 2-3 years where we didn't connect much between each other, with our physicians, with our healthcare professionals. In your opinion, how can patients, healthcare professionals, and healthcare systems in general, unite to improve the disease journey of the arthritis patient?
Yeah, so this is important, and in fact, the Canadian Rheumatology Association has a lot of connection with patient partners, obviously, and patient organizations. And so the importance is to create this sense of networking and this sense of meaningful collaboration. In the bone side, we also have this, there is a patient society, Osteoporosis Canada, who has a virtual patient network of 1,000 or so participants, even more than that, actually, it's about 7,000 people who can actually bring their voice to the table. And we are hoping to create what we call net, which is a network of clinicians, of policymakers, and of patients and researchers to come together to look at how we can research better, but how we can implement better the results of these research in clinical care. So I think if we don't have one part, so if we don't have the patient partner, or if you don't have the clinicians, or if you don't have the policymakers, you can't just implement, or you can't mobilize all this knowledge into effective intervention. So that's extremely important. And the fact that we see each other and discuss, with various people, that's the only way things will move forward, I think, in many fields, not just in arthritis or bone.
So I guess, scientific meetings like this
Are
one
perfect.
are perfect opportunities to do that.
Exactly.
Yeah, that's great. And so are there any other insights, any other information, because we have a lot of viewers out there, patients included, anything that you'd like to share that you find is important for them to improve their condition and their journey through the
Right. So I think what's important if you have inflammatory disorders is to ensure that this inflammation, with the help of your clinician and all of interventions that are recommended, that we try to reduce the inflammation as much as possible, because the inflammation does have an impact on muscle and bones. And if we can then control this, or in addition, then I think it's important to keep as active as you can. By being active, you kind of contribute to your joints being better, you contribute to your muscles being better. And it's been shown that exercise, specifically, resistance training, so small weights, will improve not only your bone strength, but will also improve your ability to move around, and will improve your pain level, and will make you feel better in general. So if there's one thing we can remember is exercise. And of course, you need to pay attention to your skeleton. And sometimes we discuss with the physician is whether we should have a test to discern whether the skeletal health is appropriate or not. So this can be done with a bone density test measurement, or some other way of, looking at how strong your skeleton may be.
Yeah, interesting. And so exercise, is it complicated, or can it be integrated easily in the daily life?
So there are multiple websites. So on Osteoporosis Canada website, for example, there are videos of what types of exercise you can integrate, and often you can do them in your home, either with small weights or elastic bands. And the exercises we promote are not, going to make you extremely fit and muscular. The idea is to tone up the muscles. And so these can be done 2 or 3 times a week at home. It takes 10 to 15 minutes. And then you can engage in other activities that you enjoy, walking, swimming, other things, more for the cardio and kind of the joint movement. But these muscle training exercises are very important.
Well, thank you so much. So bone health, super important. We're thrilled to talk to you. Any questions from the viewers?
So Isabel, we have one.
Yes.
So for any anyone who are new to exercise, they need the motivation. Do you have any tips for that?
So that's the most important point. So the idea is to try, if you like to exercise with others, is to find somebody to do it with you, kind of register to a class that tends to be more motivating. There's other people there. Find a time in your schedule that will work, because if you have to always keep changing the schedule. So most people say if you do it always the same day, always the same time, it's much easier. It becomes more like a routine. And it's really to see exercise as not so much something that's very difficult and, I have to do it, but something that will make you feel better. So it's a bit like, brushing your teeth and doing things like that. We all do it, but in the end, we're happy to do it. So if you can do it with others and enjoy that, then that's good.
Yeah, it's taking care of yourself.
Yeah.
So and making it part of your routine.
Yeah.
Any other questions? No. Well, thank you so much for your time. Thank you all for being with us again at the Arthritis Podcast Network's hashtag CR Arthritis.